Hi guys, this video is about enhancing and developing fine motors of your kid, or primarily the dynamic tripod or quadrupod grip, which is the appropriate pencil grip required to write. Now the most commonly encountered problem while kids tend to hold the pencil is either this, wherein they're holding the pencil with thumb and index finger, or this, wherein they tend to hold the pencil with hyperextended thumb and index and middle finger, but in an appropriate position. And even if they tend to hold the pencil in appropriate position, sometimes you might not see grounding of the wrist, which is an essential thing while writing. Now to help develop these things, here are the simple exercises that might be of help to you. To begin with, the first one is to develop the strength of the primary muscles that help us hold the pencil. To develop the strength, we are going to use therapeutic, which is a clay type material, and we are going to ask the kid to pull out different diameter things out of the same. So for example, this is kid's hand and I ask him to pull out 2 centimeter thing. So while doing this, the most commonly encountered thing would be that the kid would be hyperextended the thumb. Now to counter the same, I am just going to block the thumb like this. I have not assisted him, instead I am just resisting the movement. So he pulls like this. This is 2 centimeters. The next diameter would be of 1.5 centimeters. Again, I will be promoting the flexion of the thumb like this. And this. The next diameter is 1 centimeter. Again, you will be resisting the inappropriate movement and not assisting the kid for anything. The next diameter will be of 0.1 centimeter, which is primarily going to be pulled out with thumb and the index finger like this. I am just using thumb and the index finger for this, 0.1 centimeter. And the last one, just to promote the flexion with the thumb, is the use of buttons, wherein I am just using my thumb to pull out buttons inside the therapeutic. Now after you have developed the strength, I am going to develop the range of motion or the appropriate small joint movement required for writing. Now to do the same, I am going to use the small movements of my finger, which is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Similarly, making a small C like this, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now of course, when you are working on the strength, your kid still has the pencil hold like this. Now to counter the same, I may use a marker or a chalk holder or a gripper like this, which will help me meanwhile I am strengthening the appropriate muscles. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Similarly, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is to develop the small joint movement. We develop the strength with the therapeutic, we develop the range of motion of the fingers or primarily the joints that are involved in writing. Now we develop the grounding of the wrist, which is grounding the wrist while writing. Now to develop that, there are 2 strategies. One is coloring in the prone position. You make a kid lie down on his tummy and again you give a color or a crayon inside the gripper or a chalk holder and just let him scribble. And the next one is slant surface. Provide any kind of slant surface for writing meanwhile when we are working on his wrist grounding. The next is, even if we have grounded the wrist, sometimes the kids tend to keep their wrist in this position. Now to develop the opening of the wrist, what am I going to do is, One is the wrist arc, which is just opening of the wrist like this. Another one is table tennis. Now what is modified table tennis is basically you sit down on the ground and just let the kid hit the ball with the wrist opening. Now meanwhile, when you are strengthening this, because this procedure almost takes 6 to 8 months time to develop appropriate pencil grip. Now what are you going to do meanwhile? One is use appropriate gripper or a chalk holder or a marker. When we are using this, we are just promoting that the kid's finger don't go in any inappropriate position. Hope this video can help you. Thank you.